Q&A is open.
Easy questions first.
Jay and Greg, I was very impressed with
Could you, if you
Yeah.
give us our name and maybe something just, what do you do?
I told you before.
Yeah, they don't know.
Yeah, I'm Jerry Berwick. I'm an attorney local here in Boston. I was very much impressed with with your presentations, and I think you're right on the right track. But there is one thing I'm very much concerned about, and I was wondering what your thoughts were as to what can be done to correct it. And that is, you've indicated that half of the budget is for health and human services. And yet we look around and we know, okay, unemployment benefits have been extended for another 13 months. And we know that if you take a look at the people who are unemployed in the state, there are a lot of them. I mean, I'm not saying how much percentage, but you know there are a lot of them who are basically gaming the system. They figure it's better to take the unemployment than to bother looking for a job, or taking a job that will pay them less money because they could lose, it would cost them probably to even go to work because of the loss of their unemployment benefits. And there's another aspect, another problem too, and that is on nursing home care. You have people who are, will protect their assets, and it's a whole industry in the legal profession of, come in and if you have to go to a nursing home, we're going to protect your assets so that you don't have to pay for the full amount of the nursing home care, and of course leave it, and who else is going to pick it up? But the state is going to pick it up. So here you have two major situations where people are gaming the system, and and also because you have pension, but that's another matter. But I'd like to know what your thoughts are as to what can be done to curb the abuses in those two areas.
Well, it's a good question, and we are focused on those issues. I mean, there's nothing worse than precious state taxpayer dollars that are desperately needed by the people they're intended for, ending up in the hands of people who really shouldn't be getting them. The governor last year established a task force called the Fraud, Waste, and Abuse Task Force that's actually chaired by the Lieutenant Governor, and I sit on that. And it is the first time, almost the first time, I'll explain what really was the first time, that we've taken all these leaders in state government that have responsibility for identifying those situations and recovering from those who are cheating the system, like the state auditor, the inspector general, the attorney general, the comptroller, all heads of different agencies that have a piece of this responsibility, all sitting at the same table collaborating together on how we do a better job of identifying those issues and recovering. And we've been meeting now for close to a year, and we've got a lot of good initiatives going and a lot of collaboration, and I think we're going to see some good results. From my perspective, and this is a big focus of ours, particularly as we've been facing all these cost pressures, we've got to make sure our eligibility intake is tight and that we're doing everything we can to make sure that the funds are going to the people who they're intended for. So I'm not saying we're perfect at it, but we're very focused on it and trying to do everything we can to make sure that that's the result we get. In terms of unemployment, Greg may I assume he knows more about this than I, in terms of whether people on unemployment have an incentive to just stay on there. That's not my understanding of, based on the level of payments they're getting, and if you just look at the trends over the course of the recession and claims for unemployment and what's happened as the economy started to recover, people are on unemployment because they can't find a job for the most cases. And there is, to the point about the cost of benefits, one of the issues with the extensions is that Massachusetts is, I think, the only state in the country that provides has a health insurance benefit program for people on unemployment. And I believe that was initiated by Governor Dukakis. And it's called our Medical Security Program. And we've had real strains in that program because of the fact that we had not only the recession, there's more people on unemployment, because of all the extensions which have been funded by the federal government, and I don't care about as much from a state budget perspective. The insurance program is funded by us and employers, and that's been a strain. And one of the issues when I talk about healthcare cost containment that we need to focus on and figure out a solution to, that's one of the things on my radar. Do you have anything else, Greg?
Well, I'd just add, I'd add to what you said about it's a challenge when you're doing this public policy things about how to make decisions based on a few anecdotal stories. When it happens in pension reform, you get, a handful of people who are abusing the pension system, and everybody concludes that everybody in state government is making a ton of money off their pensions, when the truth is, I think, Jay, you had a statistic that 80 or 90% of the people actually just get back what they paid into the system. So the handful of people. So I think that with unemployment, I have heard also the argument about how the extension of the benefits does undercut desire to come back to work. The benefits are pretty modest. I think the average in Massachusetts is about $500 a week. So people are getting way less than half of what the average benefit is way less than half of what the average salary would have been for those folks. And particularly now, I think when you're talking about extensions for people who are long-term unemployed, I think that to me, the idea that that people are interested in gaming the system may be more relevant for very short-term situations. But when you're talking about people who had careers, they can't find jobs in the work that they've been trained or educated for, and they are the ones that we meet, the ones that the governor meet, are desperately trying to figure out how to maintain their skills and relevance. They would love to, and are concerned about their resume and their reputation as folks who haven't had a job for a while, and they want to get back to work.
Let me just add one thing to that, because I was invited by the House Ways and Means Committee of the United States Congress to testify, and while I couldn't testify, I did send them a note on what we should do with extending benefits. Of course, Republicans in the Congress have been using that and kind of holding the rest of the country hostage to get the tax cuts for the wealthy. But there was a question of when you're extending benefits, 65 weeks, beyond 65 weeks, what should be done? And I did suggest, and we can't start it instantly, but this will not be the only time we've had unemployment. We should prepare for the next one. Is that once somebody has gotten to a point where they're unemployed for, let's say, 52 weeks, the chances of those people going back to their original employer or an employer like them is remote. So that what we should be doing is to saying after 52 weeks, let's say, or X weeks, you can help us figure out what X weeks is, that a receipt of unemployment benefit should actually turn into a receipt of a sustainable income while you're being retrained. That is, that you make retraining a requirement of extending benefits beyond some level. We need to do that both because we don't want people living off of unemployment benefits. In some European countries, they can live for 4 years on unemployment benefits. But because we're going to need, over the long run, every active adult we can in the labor force, and retraining them is the way to do it.
Well, Barry, that's true. I agree with you, but my wife is involved with a company that does help retrain these people. And what is happening is that some of them are gaming it by refusing to take work because they can continue to get their unemployment benefits. And these people are being retrained, they're capable of working, and they can get jobs, but they don't want to work because they can continue to get their benefit. Now, I'm not saying that most of the people on unemployment are gaming the system, but there is a fairly significant percentage of people who are gaming the system, and this is the unfortunate fact.
We may disagree on what a fairly significant percentage is. I think the real problem, and it's an administrative problem, is that I don't think anyone up here would deny that there are some people who game the system. People game every system in the world. The real question is how do you detect those people who are truly gaming the system and do something about them without harming a lot of people who aren't gaming the system and legitimately need that assistance. And we have to think more about how to do that. Another question?
Julia Geisman, I'm a learning organizational effectiveness consultant. Much of what you both are talking about are very near and dear to my heart. However, I would like to say that I am totally impressed with what I hear from both of you, and particularly the value, the underlying value of the convergence of people and policies, you know, as the governor defines government, and that it obviously permeates your perspective. So I just wanted to acknowledge that right up front. The question that I have, though, for both of you is, what, if you look back on the past 4 years, and certainly during the economic downturn, what one thing would you like to do differently that you realize in retrospect may not have been the best decision, and what did you learn from that so you can carry that forward?
I got a lot. Oh, they go first.
I've got a, yeah, go ahead.
Well, this may not be specific enough for you, but the most important lesson that I've taken away is really, and I talked about it a little bit in my remarks, appreciating the degree that on the economic development stuff, the ability of state government to single-handedly move the needle on an issue of concern with a new program or policy is very limited, and you really have to. And this is something actually, an insight that the governor had from very early on, but really have to focus on building very broad collaborations, and that we can have the most leverage in the role of setting a direction. The governor has a great role in convening people in a bully pulpit, but just to give you one concrete example of that in STEM education, because there's an area. So the tendency of I think the automatic reflex of state government to say, oh, there's a problem, so we're going to start a program to fix it. And when you look in this state, just as an example, so there's such a tremendous network of folks, individuals, companies, academic institutions who are who are interested in trying to improve our science and math education in our schools and are doing things. And that if we try to invent a new state program to improve on that, we're almost certainly not going to do better than that. And we have taken the view that really our most important role is simply to be a coordinator and to say who's doing what's working better than other things, how do we capture all this civic engagement and volunteerism and send it in the right direction. And that's something I think we've started to do much better. I can tell you a lot of examples of the things in my secretariat that we did over the last 4 years. We did take that instinctive approach to here's a problem, start a program, and that we, in many cases, some cases we backed off because it didn't. We learned it wasn't the right thing to do. In some cases, we didn't back off until Jay cut all the budget for it, and then we said, "Oh, we got to do this a different way. Maybe we can leverage other resources." But that, to me, now I'm just convinced it's the leverage, and it's part of it because of the budget, but just the leverage is the most important thing.
I've got some specific things which I won't talk about, but for me, the way I would answer that question is in terms of approach. One of the things, I was not in state government, I've never been in government before Governor Patrick was elected. And it's been a huge learning experience for me. One of the things I love about government is it is a unique dynamic in terms of the interaction with the dynamic with the legislature, and actually in order to do anything or most things, having to work with them and that whole process, there's nothing like that anywhere else. The press being a part of it, all the different stakeholders, that in Greg's example, to collaborate to get things done. There are lots of people involved and lots of institutional perspectives that are brought to state government that impact our ability to do things. And one of the things that I think, and I would guess the governor would say this also, we as an administration in the first term, and many of the things that I personally worked on, a lot of times we would think up the policy pursuit we wanted to take. And there were some examples of times when we just put it out there and didn't do enough talking. And I think it's not a surprise maybe, and this isn't unique to government, it's life generally. Communication and working with people makes a huge difference in anything. And I think it's particularly true, the biggest lesson I've taken from my time in state government so far is that is critically important to being able to move any new policy forward. And so I think there's a recognition now but more so by the governor and the rest of the team who've now been there for a while, that we need to not worry as much about what the impact is going to be when we roll out whatever the proposal is. We got to make sure that that proposal, when we roll it out, is something that has had the benefit of the input of all the different stakeholders, the legislators, the beneficiaries, the critics, everybody, so that we put out the best policy proposal we can, and it has the best chance of actually happening and making a difference. And that, I would say, for me, that's the biggest lesson I've taken from the first term.
Hi, David Orr, Project Management. This might be kind of a wonky question, but in my study of the state kind of governmental structure, the use of the authority I haven't seen too much elsewhere, especially in California. And I understand it's kind of an autonomous financial and political structure. And why is it? Where did it come from? And why is it so prevalent? And does it hinder the state's, fiscal goals?
Independent authorities?
Yeah.
We each probably have a perspective on that. I think there are different reasons they're created from policy reasons. A big one is that for financial reasons, sometimes it is important to have an entity that is separate from state government with a separate balance sheet to carry out certain financing programs. So for example, Mass Housing is a quasi-public authority that exists in Massachusetts, whose sole purpose is to essentially serve as an affordable housing bank. They have certain federal and state subsidies that are available to them to reduce the cost of the financing they can provide to affordable housing developers and to low-income people looking for mortgages. And those they have like, I don't know how much, but I think it may be around $2 billion in outstanding debt that they issue to finance all these affordable housing projects. That's a very discrete purpose that needs to be focused on the special streams of revenue they have, all the loan repayments and everything else, to maintain a sustainable financing program to serve the public mission. That would make things messy for us as a state if it were a part of our balance sheet and our financial picture. So there are financial reasons that a lot of them are set up. I'd say that's the reason for Mass Housing and Mass Development and what was Massport. So that's a big reason why a lot of them are set up. A lot of times it's political decisions. A lot of these agencies could be set up as state agencies and within state government, and there are political decisions made. The transportation reform created a new transportation agency, MassDOT, which is an independent authority technically. There was a lot of debate when we were developing that legislation about whether it should be a state agency, which was actually the way the governor originally proposed it, is a new state department bringing the turnpike in and all the other transportation agencies that manage transportation assets, or whether it should be an independent authority. And the legislature ultimately decided to make it an authority, but we made it this weird beast where in many ways it's subject to the same rules that state agencies are, It's got a secretary that's appointed by the governor, that's the CEO of it, and it's got an independent board. There were good reasons to make it an independent authority. The Turnpike has a lot of bad debt, which is still off of our books and isn't impacting our bond rating to finance all our capital program. From my perspective, that's good. There were a lot of reasons to make it a state agency. Clean governance, clean accountability, control. So there are different factors that influence it, and a lot of these beasts are created for different reasons. And I don't think there is a standard answer to any of them.
So just add a little bit to that. So Jay's given you sort of the reasons, the sort of technical reasons for why independent authorities are most frequently created. It's some version of basically they're going to be able to do their business more effectively if they can have a balance sheet that's separate and apart from the state balance sheet. But what's interesting in Massachusetts, and I think accounts for our frequent use of them, is that layered on those kind of technical reasons, at least over the last 20, 30 years in Massachusetts, there has been a sense that you're much more likely to get a professional management and outcome if you had an independent authority than if you had an agency within state government. It was just a general reflection of public sentiment that the quality of and the professional level of management and operation within state government in Massachusetts wasn't that high, and if there are things that were important to us, we really had to put them outside and for example, stagger the appointment of board terms so that a governor can't take over a board quickly and insulate them from politics. We actually, the governor and I think the legislature both have felt that the pendulum did swing too far in that regard in Massachusetts, and that what happened is we created all these, the governor says that people use terms quasi-independent agencies, and the governor says that they've all forgotten about the quasi part, and they're just totally independent agencies now. And so there was a sense that, and we did, and I think in a lot of ways, I hope that the governor, through the way he has run things, has restored some folks' confidence that things could be done and professionally managed within state government. And so he has been asking to get back some more control over those, and the legislature has been doing that. So just one little instance, for example, it's now by statute for the independent authorities that relate to economic development. The legislature said, well, they're so disconnected from where the governor is trying to go, we need to restore some of that. So for example, they've said that the Secretary of Housing and Economic Development, by virtue of his office, is now the chairman of the board of all of those boards, as one way of just saying, okay, so at least there's some line of communication and to get some feel that those folks are going to be headed in the same direction that the administration is headed. And there have been some other things as well that have kind of tightened that up a little bit. And so I think the pendulum is swinging back in Massachusetts.
Thank you very much. Our next question.
All right, Simon, I'm in housing and homelessness prevention. My question is more towards for you, Greg. I appreciate hearing the ideas and what Massachusetts has done in the past 4 years and kind of where they want to go forward with economic development. I'd like to know a little bit more about housing and how the state decides and wants to move forward with housing and affordable housing more particular, knowing the strong support with question number 2 on the ballot. Does that mean anything to the governor? And knowing that there's a lot of support from the voters, is that going to affect and support his budget for affordable housing?
Right. So the affordable housing is a very important part of the governor's agenda, and I think actually one of what he would consider one of his very important accomplishments very early in the first couple years of his term was to pass a very comprehensive housing bond bill that actually recapitalized the money that's available for a lot of the work that we do. And for those of you who aren't familiar, we both provide subsidies and support for the private construction of housing that is affordable, restricted as to renter price to be affordable. We also have a very substantial public housing stock in Massachusetts. Actually, this is something I learned in the last 4 years, relatively unique. In most states, the public housing that exists is almost all federally subsidized public housing. In Massachusetts, we're one of only 2 or 3 states in the country. We actually have about 50,000 units of housing that is totally state subsidized. It's only there because of the investment that we make in it. That had gotten into a rather shameful state of disrepair over the last 20 years. And we've really started to very systematically invest in that. On the area of homelessness, that's probably the area where we have made the most dramatic policy change above and beyond just putting more resources into it. We really went with, we have gone towards a housing first approach, and this is something that I think is an innovative idea. It's not unique to Massachusetts, you see elsewhere. But the idea is based on the fact that, first of all, providing emergency shelter, or providing it, whether it's a Pine Street Inn setting or whether it's a hotel or motel, that we literally rent rooms for families, people with young children who are homeless. It's an extraordinarily expensive way to address the issue, and it turns out that if you take a housing first approach, in other words, do everything you can, first of all, to identify people who are at risk of becoming homeless and figure out what it takes to prevent them from being homeless, maybe helping them with a 1 month's rent payment that they can't afford, or a missed mortgage payment or something. And it turns out on average you can keep them from being homeless a lot more cheaply than you can by putting on for some period of time before they can get back into a stable housing situation. And that's on the front end. And similarly on the back end, we had a system where the people who were operating the homeless shelter system, they were within our Health and Human Services division. And basically their job was to make sure that people did have shelter when they said they needed it, when they were eligible for it. There were really no incentives to help people get back out of shelter again. And so we moved the whole group over to our housing group. And so first of all, we are experienced in identifying folks who are at risk and figuring out ways to prevent a homeless situation. We're also much better at identifying what are appropriate housing, rehousing solutions for people who are homeless. So we've really, the numbers, we haven't made as much progress as the numbers we would like, mostly because given the economic circumstances, the number of people who are presenting themselves as needing being homeless and needing a shelter just spiked tremendously. But we're very proud of this, even though the entries month by month have gone very up, the exits have gone up very dramatically as well. So in other words, we're doing a much better job of making being in a homeless shelter a very temporary condition for those individuals and families, and finding them new housing solutions again. So it does seem to be working, and in fact I think one of the things you'll find in the governor's new budget is we're going to talk about whether we can, there's room to, there's no new money, so we're going to have to rearrange money, but even continue even more in that direction and put even more emphasis on preventing homelessness and rehousing, and try to really minimize the portion of our housing budget that's spent literally on those homeless shelters in the middle.
We have time for a couple more questions. Maybe down here.
Good evening. My name is Ed Craples, and I'm in the energy infrastructure investment space. And I have a question for Secretary Bialecki. The Green Communities Act was a signal achievement of the governor's first term, and it was simultaneously an environmental policy, an energy policy, and an economic development policy. It was an economic development policy because it restricted things that could qualify as being compliant with the Green Communities Act in terms of energy supply. And we have, if you look at Israel area, the Israeli energy policy, the energy policy of a number of countries has actually created a thriving energy employment and economic development sector. And that's under your job description. So I wondered if you had, for the governor's second term, thoughts about how the implementation of that act might be something that could create employment in Massachusetts and the UNO.
Yeah. So obviously we agree with the premise of the question that we see the Green Communities Act in a number of the other initiatives that the governor has taken in the area of clean energy and energy efficiency, not only as being good green things to do, but as being economic opportunities. And I do think that we have, unfortunately for California, we've a little bit, we've benefited both because those policies, I think, have put us on the map as a state, and I think also California was the state has been really a leader in those areas, and given their financial and other difficulties, they've stumbled, and I think they've sort of lost some of the winds come out of their sails in terms of what's happening there. So I think we have really moved a lot of attention to Massachusetts. We see the economic development opportunities in a number of ways. One is the literally companies that are engaged in development, manufacturing of clean energy technologies, wind, solar, and otherwise. Secondly, we see the real birth of new companies in the areas of energy efficiency. And the third, interestingly, is a little more intangible, but we find that for a lot of companies now, this sort of the green ethic is so prevailing that it actually really gets very involved in their corporate decision making. So that, for example, for a lot of companies, the decision about where to locate, some traditional characterizations of the cost of doing business in that state, or where's their distribution network or their customer base. For a lot of companies now, they're adding into it, are they in a green, are they in a green environment? And so, in fact, the fact that the electricity that they use to run their facilities is coming from, a very high percentage of renewable resource and so forth is of value. So actually, we're actually, Ian Bowles, the Secretary of Energy and Economic Development, and I are working jointly on actually a little study to that effect, where we're trying to do a better job of outlining both the cost and the benefits of our clean energy and energy efficiency initiatives. But I think one of the things that we'll be cataloging is those various ways in which it has been, actually it's already demonstrably been an economic development engine, and I think will continue to be as our reputation as a state grows in that way. One thing just challenging with respect to Israel, just add, there's a lot of, it's challenging national policy versus state policy. It's just a whole other subject. It's very complicated about what we can effectively do as a state versus what should be done as a matter of national policy is a challenging question.
I think we have time for maybe one more question. Here.
Again, Charlie Lyons, I was an Allerton selectman for about 24 years and superintendent for beginning my 25th year in February. And this is a question of health.
Of the Super Bowl championship.
Division 4, Shawshank Rams. Which Mike Lynch, by the way, will make us the high five this Tuesday. So but, the whole challenge, I think, for us next year is going to be about health care. And I remember back to the mid-'80s when Sims Hospital was an important employer in Arlington, and it closed during the early 90s. But back then we had 135 hospitals in Massachusetts. We're down to about 70 today. So we've closed half the institutions. Of the institutions we have left, about 41% made money last year. Close to 59% operated in the red. And what I'm trying to figure out in my mind, I understand that if you get your employees to feel better and not use the system or access the system, you can actually do some things to save money. The healthcare costs are going up 10, 11% a year. And now we have two main entities, partners in the care group, that probably control 50% of the admits in Massachusetts. The concern I have is who does what, who polices the cost in order to minimize the impact. In town of Arlington, in 2000, Jay, we spent $6 million for healthcare for employees. We're spending $19 million today. And the tax levy increase next year is about 2.1 million. That's the cost increase they're gonna experience in healthcare costs next year, without some level of plan design flexibility. The plan design issue, I don't completely agree with, because I think simply taking the cost from the employer and shifting it on employees isn't the long-term answer. And that's what you get if you simply make a plan design decision. But what can we do about the cost of healthcare, and who can police it, so that we make sure that the dollars we're spending are going for the services and not for other things? That's the question. Thank you.
Well, save the easy one for the end. I'll take a stab, and then Greg might have some stuff to add, but this is a huge, complicated, difficult problem. And the governor's been really clear that it is one of his #1 priorities for the second term. He wants to do something about it. And it's a problem here, and it's a problem across the country. I think, it's clear, and there have been a lot of reports coming out, that our healthcare sector as a market is dysfunctional right now. You probably, if you were here on healthcare cost containment night, my guess is whoever was here speaking that night probably talked about payment reform, and the fact that what is considered to be one of the big problems with healthcare costs, and how we get at the fundamental question of cost, as opposed to, as you said, who's paying the cost, is the fact that we have a healthcare system that right now, basically, we make payments for particular services or particular visits to doctors, and so all the incentives are around providing lots of services, lots of tests, lots of drugs, lots of doctor's visits. And there isn't an incentive on the provider care side to manage the care, and the policy people who know about the quality side say this impacts quality too. That by changing the payment system to incentivize the providers of care to have an incentive in managing it in a cost-effective way, which goes hand in hand with improving the quality of care, because the better job you do the first time in addressing whatever the healthcare issue is, the less money you will spend addressing that problem. So that's the conceptual theory that I think in Massachusetts we've got a stakeholder community, providers and insurance plans and government and consumer groups who all agree. There was a commission a couple of years ago that really focused on this and developed a report with recommendations that we need to move in that direction. There are lots of details, and everybody cares about the details, and because they're very important. This is going to be a fundamental shift, if we can get there, in how healthcare is provided and what the incentives are behind that. The governor's very focused on this, and I think there's a great interest in the legislature and in the community to get there. The question is how those details get worked out so that we can be successful. And that is exactly the kind of example of a situation I was describing before in response to Julian's question, that we need to do lots of talking and lots of communicating and lots of working together and collaborating to get to a place that is going to allow us to be successful as a state in this effort. And it's one of the reasons we got to the first stage of healthcare reform here, where we expanded coverage, was because the state's healthcare community and all the different stakeholders worked together to get to that result, and that national trend setting solution. And I'm optimistic, I think the governor is, that we will get there, but it's not gonna be easy, and I think that's the kind of, I think the consensus is that's the direction we need to go.
Just very quickly, to me, John, I answer your question a little more philosophically, because I think fundamentally, we have the big question one of the big questions, maybe the big question confronting us in healthcare, in cost containment. When you say who's going to control it, it's there may be shades of gray, but it's pretty fundamental about we're either going to be looking for a market-based solution to try to control it, or we're going to be looking for regulation and control. And I think one of the challenges in healthcare is for the last 30 years in the United States, our answer to everything about how to make it better was to have less regulation and a more competitive market, and things will work out. And if you just look at healthcare, I mean, it's if you had any candidate for a dysfunctional market, healthcare is it. You have consumers who have no idea what they're buying. We have consumers now, given our current state of insurance, have no idea what things cost. If you go to Dr. A or Dr. B, you're going to pay a $10 copay either way. You have no idea whether one's charged 3 times as much for what he did or she did for you. So there's a lot of reasons why to think actually and if people talk about greater transparency, and we'll just tell everybody what every hospital charges to deliver a baby and how much it costs and what the average quality of outcome is. And I'm just very skeptical to really think that you can just create a better market and that'll naturally control costs. So I think it's going to be a hard question for us as a country, because I think our instinct has been to not look at government regulation to do it, but I'm not sure how else we're going to get out of it. The only other way I think that we can imagine getting out of it and to get some real progress on the market side without having the kind of worst kind of command and control regulation is just to observe the fact that the largest purchaser of healthcare services right now is government. And so maybe we say that the role of government isn't as regulator, but just as a leader as a market participant, and saying, for example, this is the way, if you're going to sell to us through Medicare, through Medicaid, there's one billing form, that's it, everybody's going to use it. Well, if everybody has to go along with that for Medicaid, frankly, for a lot of docs and hospitals, that's their biggest customer. So if the privates can just say, well, I want to do the same thing, and people will follow on. And that may be a way that government can create some order and some discipline, or I'm not, there's certain procedures I'm just not going to pay for, and create those kind of controls and use their market power, maybe one way to get some progress.
Well, I'm afraid we're out of time. A quick one.
Okay. When I was here for the health care, and they had the president, the CEO, they had the CEO of Blue Cross. And he was commenting that an MRI, that when you deal with partners, you pay $2,100 for an MRI. When you deal with anybody else, it's $700. And I said, well, why do you do that? I said, you have tremendous buying power and everything else. Why can't you tell partners, hey, you can't charge $2,100?
Right.
And their answer was, listen, you want to do business with us, you have to pay the $2,100, and that's a big problem.
Well, and that's why I think that, but I think government has a better chance. I mean, part of it is if you look, when you talk to some of the participants, again, if you're using this market model, this is supposed to be a market, a lot of the participants can't even talk to each other for fear of being sued for an antitrust violation. So now you're supposed to compare notes about how much, telling each other in some cases, how much different insurers or partners is charging them for an MRI. They can't even sit in a room and discuss that. So I think that there are ways in which we can intervene and say, if we're the leader and there's certain things and set the bar, it's going to be a lot. We've talked to a lot of the insurers about it, and it's going to be easier for them to follow.
Well, I want to thank our two guests. Gonzalez, Bialecki, thank you for joining us tonight for a stimulating and very exciting discussion. But I also want to thank all of you, because this has been an extraordinary semester. I love the fact that I see so many faces that I've seen throughout the semester, and we're glad to have you. We hope you'll join us next semester as well, and we have a wonderful lineup of guests coming to us. And I want to thank you particularly for the marvelous questions that you asked all semester. I think it led to some of the best discussion and best comments that we had. So thank you, and I'd like to applaud all of you for being here. Have a pleasant evening, a happy holiday, and we'll see you on January 12th.